So I wanted to talk about my obsession with the superficial branch of the radial nerve and the dorsal cutaneous branch of the ulnar nerve. And it's in response to people on some of these TFCC sites posting about how they have such severe pain and no one's really hearing them. And we're assuming that these surgeries, like the de Quervain surgery or the TFCC surgery, is related to the surgery. But a lot of times it's related to the scar tissue and the tensions that are pulling around that. So if we look at this, so the SBRN is going to kind of come up here to the tip, down here, up here, some up there. And you have your tendons as well. So we've got tendons, wrist tendons, okay? So we have a bunch of tendons, a bunch of sensory nerve activity, and let's make sure we take these up to the PIP joint. Branching up here too, okay? And then we'll do a different color. On the ulnar side, we have right here, okay, the sensory branch of the ulnar nerve, okay? And sometimes we can say, we'll go up this side. You can share some of this from anatomy books. Sometimes they have shared sides, but essentially this is where they're gonna feel it. So the problem is, especially right here at this target, and if we have a surgery that is in this location right here, then this has a huge potential right there to be cause of a lot of the pain. As this surgery, the tensions, you know, this could be pulling that direction, the skin, and it kind of strangles that nerve as it goes over the top. Same thing over here. So if we have our surgery somewhere in here for de Quervain's, DQ, okay? Then we have this possibility that we're strangling the sensory branch of the nerve. And the interesting part is part of this nerve will go in and innervate the CMC joint. So when we have the CMC pain, so another scenario, CMC joint pain, if they have good range of motion and they don't have a positive grind test, they just have a lot of pain in this location, then maybe we should be looking at the sensory branch of the nerve a little closer. And then we get these people that are doing their gaming and their texting or their mousing and clicking. And what happens is they start hinging on these joints right here, and definitely the base down here, as the thumb continues to move this way. And it's not weird as well that people would tell us that they have pain here and a very stiff index finger, especially right here. So at the radial collateral ligament, the index finger is a large area that I find things get caught up. So not weird if they report pain here that travels up into the hand. So that's usually the scenario that I find. We need to try and free up the sensory nerves. And there's lots of ways to do that, but essentially we need to get all of this tissue settled with desensitization. That could be polypellets and vibration. Take tiny tools and start scraping the tissue to try and free up all the nerves from the skin. And if you have even things like a distal radius fracture scar, or a CMC arthroplasty and they've taken the tendon from way up here, remember this tissue pull towards here can also result in the nerves along the side being strangled. So the scar tissue, you've got to find out which direction it will go to relieve the tension on the sides of the hand. So hopefully that helps, and hope you had a great Christmas.